In this video, we are going to look at the anatomy of the axilla. But before we start, please like the video, subscribe to the channel, and also leave your comment in the comment section. The axilla or the armpit is a connective tissue space, mostly surrounded by muscles between the lateral thoracic wall and the upper part of the arm. Important nerves and vessels pass through the axilla from the neck to the upper limb. When the arm is abducted, the axilla resembles a four-sided truncated pyramid. Hence, the axilla has the apex, the base, and also the four walls. And for that case, the axilla will appear in form of a truncated cone. The apex or the inlet, it is directed towards the root of the neck and lies behind the middle of the clavicle. Its passage for structures entering or leaving the shoulder region. It's bounded by the clavicle, scapula, and the first ribs. Hence, these structures form its triangular walls. So the base or the floor. The base faces inferiorly and is formed by the fascia and the skin covering the concavity of the axilla. The skin is normally covered by coarse hair after puberty. Sebaceous and sweat glands occur in the dermis of the skin. When the arm is abducted, concavity of the axilla is further defined by two folds. The anterior axillary fold, formed by lateral border of pectoralis major muscle, and the posterior axillary fold, formed by the teres major and latissimus dorsi muscles. Walls of the axilla. The anterior wall is formed by pectoralis major, pectoralis minor, and clavipectoral fascia. The posterior wall is formed by the scapula and subscapularis muscle, teres major muscle, and latissimus dorsi muscle. The medial wall is formed by digitations of the serratus anterior muscle, ribs, and intervening intercostal muscles. The lateral wall is formed by the intertubercular groove of the humerus, coracobrachialis muscle, short head of biceps brachii muscle. Contents of the axilla. The contents include the axillary artery and vein, axillary lymph nodes, and part of the brachial plexus, specifically the cords of the brachial plexus. Let's now look at the axillary sheath. It is an extension of the prevertebral fascia of the neck into the axilla. The strong fascial envelope surrounds part of the axillary artery and vein, and also the three cords of the brachial plexus. The artery may progressively develop localized dilation, and this is what we call aneurysm. This may cause compression of the nerves of the brachial plexus since the fascial teeth is not very distensible. Compression of the nerves would lead to pain and disturbances in the neurological function in the areas supplied by those nerves. Thank you.